cancer, by and large, are HPV infection. However, there are certain behavioral markers that might increase a person's risk for becoming persistently infected with HPV. One is early onset of sexual activity, and that is because in young women, the cervix is somewhat exposed in that the inner canal is more external, so it's more open to getting exposed to infection. When a woman gets older, that kind of involutes and kind of goes up into the cervical canal. And once a woman is postmenopausal, it is much less likely that a woman would be de novo infected with HPV, even if exposed. And that's one reason why if a woman has been screened her entire life from ages 21 to 65 and has not had abnormal paps, has not had HPV, does not have HIV/AIDS, which is another risk factor, then we can discontinue pap smears. Doesn't mean you discontinue pelvic exams. You still need to see your doctor and get periodic exams. But the actual scrape of the cervix, which is the pap smear, after several decades of normal testing, we can then discontinue screening. So early sexual activity, cigarette smoking, and concurrent infections, particularly with HIV, are the greatest risk for that cervical cancer. But many women can still get cervical cancer and not have those risks and simply have just had one sexual partner. That's why we start the PAPs in all women at age 21. And regardless of sexual history, we do recommend periodic pap smears and pelvic exams. And the same is true for those women who have received the HPV vaccine. They still need to be screened, even though they are, of course, at lower risk for remaining persistently infected with HPV.